taking your third Hapa video. I liked how you checked the patient's chart, you performed hand hygiene, introduced yourself to the patient, you identified the patient with 2 identifiers, but you were supposed to provide privacy before coming into the patient's room. You explained procedure to patient, you asked about heart disease, chest pain, asked about if heart feels like it's fluttering on the inside. You asked about cold hands and feet, tingling sensations, swelling and lightheadedness, but you didn't ask about high blood pressure or high cholesterol, heart murmurs, if the patient smokes or drinks, and you didn't ask about what kind of medications they're taking for their heart, if any, and you didn't talk about or ask if they have a cough or if the patient exercises or about cyanosis or pallor. You listened over the skin and not closed. That was good. For the heart, you inspected the apical pulsation at the 5th intercostal space at the mid-clavicular line. I noted that there were no heaves or lifts. That was good. At the aortic, you noted that S1 and S2 were noted, and that the rate and rhythm were regular, and that there were no murmurs. That was good. For the pulmonic, you noted that S1 and S2 were present, and that the rhythm and rate were regular, and that there were no murmurs. For Erb's point, at the 3rd intercostal space, you noted that S1 and S2 were noted, and that you said that they were the strongest at this point, and that the pulse was strong and audible, no murmurs, and that the rate and rhythm were regular. At the tricuspid, you stated that it was at the left 5th intercostal space. That was good. And you noted S1 and S2, so that the pulse was strong, the rhythm and rate were regular, and that there were no murmurs. For the mitral, at the 5th intercostal space, mid-clavicular line, you noted that. That was good. You said that S1 and S2 were noted, and that the rate and rhythm were regular, and that there were no murmurs. For the neck, it was good that you had the patient lie down to check the jugular vein distension, and you noted that there was no jugular vein distension. And then you had the patient sit back up. You palpated the carotid artery one at a time at the lower 1/3, and you said that it was palpable, the rate and rhythm were regular on both sides, and you used the bell of the stethoscope to auscultate the carotid arteries. That was good. For the left side, you said there were no bruits or thrills, and that the pulse rate was regular, and that the rhythm was regular. For the right side, you said that the pulse rate was strong, regular, and the rhythm was regular, and that there were no bruits. For the upper extremities, for the left arm, you said that there was no edema. You assessed the symmetry, and you also assessed the radial pulse, but I couldn't see where your hands were. And you asked the patient if he was a runner. I thought that was a good thing to ask. You said that the patient has a strong radial pulse and gave it a grade of 3+, and said that the rhythm and rate of pulse was regular and consistent with heart sounds and carotid sounds. But you didn't talk about the hair distribution. For the right arm, you said that there was no edema. You assessed the symmetry, and again for the radial pulse, I couldn't see where your hand was. You said that the skin was warm and dry to the touch. But you didn't talk about hair distribution again, and you didn't check for lesions on either arm. You checked the capillary refill of both hands, and you said that they refilled within a second, so that was good, and that the circulation, and you said that the circulation was good, and And I thought it was nice that you told the patient that he can put his shirt back on after you were done. For the lower extremities, you didn't take the posterior tibial pulse, but you did take the dorsalis pedis pulse, and you said that the skin is warm and dry. You assessed the symmetry, and you said that there was no edema on either foot, and you didn't assess the capillary refill on either foot, and you didn't assess the posterior tibial pulse on either foot. And just remember at the end you would perform hand hygiene and clean your stethoscope. Thanks, Chris. I hope that this helps you.